Welcome. This is the shorty on respiratory infection. So let's get started. So there's kind of three basically big infection that you should be aware of is pneumonia, tuberculosis, and influenza. And so basically there's different type of pneumonia, as you can see from this slide over here. The main one that you want to make difference with is a pneumonia versus a tuberculosis, because sometimes they look the same, but basically a TB is something more chronic. And so basically what it means is that the cough has been lasting for about 3 weeks. There's a weight loss. There's also be coughing up blood, and fever won't be just there not because both have fever, but they'll be also sweating at night. So those are kind of the big ones to differentiate from TB pneumonia. And why do you really need to make the distinction is that TB will need a different precaution than pneumonia, and different treatment as well. Now that we're talking about TB, how does it spread? Is basically it's an airborne, so that means that you can be in the same room as they are, and the air will be spreading through it. And so you have to be very careful about breathing the same air. So that's when you start needing the N95 stuff. But it's not spreading by sharing the food, touching the bed linens, or toothbrush, or kissing, or things like that. So it's not direct contact. It's more like being in the same room as they are. For influenza, quite important to make influenza the difference between influenza and RSV. Basically, RSV is what most people call like the common cold, and influenza is the flu. So basically, in RSV, as you can see, there's more rhinorrhea, is basically runny nose. Wheezing is kind of a sound that you hear on auscultation. Dyspnea means like difficulty breathing, and you also have some sputum production. So basically, you'll be coughing stuff. But influenza, you can have it as well. But the main difference here is that the fever is way higher in influenza. Myalgia means that there's pain all over the body. So you know, when you have like those pain in your muscles and stuff that you cannot relieve, that's what myalgia is. And sometimes influenza will have gastrointestinal symptoms, so nausea, vomiting, which RSV don't really have. And so that's the quite difference with this. And the reasons that make the difference, because influenza, when we get the flu shot, this is for what it is to prevent that. But also influenza can turn into a pneumonia, so you can have a little bit more complication. That's what people die, not so much of the cold, but they die of the influenza. So that's the dangerous one. For prevention, if you have a room well ventilated with a lot of lights, you could decrease. There's some studies that shows, and in place like Africa and things like that, that if they have a ultraviolet light, but here, because we don't have the lights, just even the ultraviolets from the sun, you could kill a lot of the bacteria there is, and it decreased the spreading by 70% in some studies. So if you have a room that has like this very window, but be careful of the direction of the ventilation, because you don't want to bring the bacteria, especially like if you have TB, inside your so if, let's say you have a guest room and you open the window, well, the wind will come in and bring the particles this side. Well, if everybody is here, then you're bringing the contamination there. The air has to go this side. So you have to find a way to create, to be mindful of where the ventilation is. It's not to create just a wind, but the wind goes in the right direction that you want, meaning that it has to go outside of where you live, not towards where you live. Vaccination, there's some good vaccination, and I did a video explaining my view on that, and I think it's a good way to prep, because if you vaccinate yourself and stay up to date, there's a lot of disease that you may not get, and all those all those disease here can cause pneumonia, so it's a good way to get prevented. Those are the higher risk people with certain risks, that they will become more risk of getting pneumonia. And for the precaution for TB and unknown source, so you're not quite sure where you have, it's always better to err on the air precaution and go full airborne, versus influenza, RSV, and pneumonia, it's droplets. So the only difference between droplets and airborne is that at droplets you don't need an N95, airborne you do need an N95 mask. For treatment, there's a mnemonic here that we use in the hospital. It's called the ICOF, and basically it's sensitive spirometry, and I put video down. You need to cough and do some deep breathing exercise. Oral care, because your mouth sometimes can have bacteria that can go over there. Have your head a little bit up, and get moving. And so it's not just if you have an infection, but also if you're bedridden for whatever reason, you broke your leg or something like that, you're more at risk of getting pneumonia. So that's a good time to start that. If you have, again, RSV or influenza, that would be a good time as well to start the ICOFs, to make sure that you clear those lungs and you don't go from an influenza to a pneumonia. So it's a good mnemonic to remember, and this is why it's in the prevention. And this is an incentive spirometry that's been improvised. And to finish, this is what we call postural drainage, and basically I'll put a video what it looks like, but basically there's 3 different forms that you can do depending of which part of the lungs you're trying to cleanse, but that can be done at home, and it could be a quick way of treating. So that was the quickie, the shorty, on infectious disease, respiratory infection, and I'll talk to you soon.